Dr. Huebner here, Natural Transplants. There's been a lot of questions recently about what the HUE process or HUE process is all about. And I'd like to just do another video explaining the differences and exactly what HUE or high yield unit extraction. So high yield unit extraction is a take on the traditional strip method that a lot of clinics use, but it's done in a way that improves density and maximizes the amount of hair that one can get from a single transplant. And how is this done? Well, number one, the length of our strips tends to be longer than most clinics. At minimum, we're dealing with a 30 centimeter long strip. And I like to talk in terms of centimeters of tissue moved because no one talks about it. Everyone talks about the number of grafts as a measure of how much hair you're getting. And it couldn't be further from the truth. There is some correlation, but most people don't understand the difference between number of grafts and number of hairs and amount of tissue, completely different. In a traditional clinic, a strip is taken out, and that strip might be anywhere from 15 to 20 centimeters long, okay? Doesn't involve the side of the head where you can still use hair on the side of the head, and a lot of clinics they shy away from that hair. Not all clinics, but some clinics only will use the central portion in the back of the head. They'll take that strip, and because they're paying per graft, they're going to take that strip and cut it down into as many small grafts as possible. So if they have a piece of tissue that they make a slice with the tissue, and there's say 4 hairs in it, rather than using that as a 1 graft, 4 hair graft, they will divide that into 4 individual 1 hair grafts, and now they can charge 4 times as much. Now you have 4 grafts, but it's still 4 hairs. The 1 4 hair graft and the 4 1 hair grafts is still 4 hairs. And now what happens is the patient gets a bunch of tiny grafts everywhere, in the central portion, the crown, and 1 hair grafts don't give you any density, any meaningful density. Now there are places for 1 hair grafts, and we certainly use a lot of 1 hair grafts, 2 hair grafts, and those are usually done in the frontal hairline, the temples, places where things need to be soft and natural. But there is a place for those larger grafts in the central portion of the head, in the crown, in the back. These are places where density is a little harder to create with the 1 hair or 2 hair graft. So that's the biggest reason that our HUE process is different. But secondly, we have experienced technicians that have 17, 18 years experience only in hair. We do it longer, we do it wider, everything to maximize the amount of hair for a patient. And we can do that because we only do 1 patient at a time. We don't have people lined up in rooms. So we can really take our time, maximize the amount of tissue we can get for someone, and give them the maximum amount of hairs, up to 10,000 hairs per session with a density of 30 to 40%. If you have any questions about the HUE process, please give us a call, 844-327-4247. Thanks everyone for the feedback we've been getting on our YouTube videos, and I encourage you to subscribe for updates. Thanks so much. Call us now, 844-327-4247, and ask about our HUE and HUE Plus procedures, which move more hair than ever before. Hope to hear from you soon.